Dr. Bushore here, going to be talking about one cleanser I could recommend to almost all my patients. It's called Asceptic MD Cleanser. What I like about this cleanser, it's special in that it's only got one active ingredient. It's called chlorine dioxide. It was created by dermatologist Dr. Matt Zerwas. Chlorine dioxide has been used for a long time to clean our fruits and vegetables, but what's special about it when it comes to the skin is it will actually help break the little keratin bonds that make skin cells stick together, and that's what drives a lot of the processes that can clog pores, so acne and things like that. So it breaks apart those little keratin bonds without being irritating. So everything else we've used to kind of help treat acne, like salicylic acid, those things, the acid helps. It can help break apart it helps exfoliate, but it also can be irritating to the skin. This does not do that, and so that's what's nice. It helps it gently exfoliate without being as irritating as salicylic acid. So I do like it for acne patients because it helps. When you use a topical retinoid, you probably notice when you get in the shower and go to wash your face, you're kind of rubbing off the dead skin cells. This will help get all that off for you, so you can get, the skin will be clear for the day, or if you want to put it on, use this right before you put your Retin-A on, you're going to help that Retin-A penetrate and work that much better. But anybody using a topical retinoid, so even if you're using it for cosmetic reasons, this will help smooth out that skin, get that skin looking perfect for the day, so you can put your moisturizer, everything works really well, and then also to make that Retin-A penetrate and work that much better at the end of the day. So acne, cosmetic patients, anybody on topical retinoids. Keratosis pilaris is a very common condition that maybe you've noticed where people get like red bumps that are kind of dry on the backs of the arms. This is actually a dry skin problem. So if you're going to use like a salicylic acid wash, you worry about, well, that's just going to aggravate it and make it worse. And they did a study where they showed that if you use this with a washcloth, you could rub it with a washcloth on these areas and use that every day for a month, and all that got better without drying or irritating the skin so much. So I do like it for my keratosis pilaris patients. I'll recommend this along with a moisturizer. And then the other condition that I recommend it for is what's called hidradenitis. Hidradenitis is an inherited condition for people who get these little red bumps that are under the arms and the groin area. It's not an infection, it's not a bacterial problem. But what happens is you inherit a tendency for these weak follicular walls. So people think that it's a bacteria problem and they scrub too hard. We don't want to do that. So that's why this works great, because it helps break apart those keratin bonds that make the skin cells stick together, and so it'll open up those, keep those pores from getting clogged and irritated, but in a gentle way, without drying or irritating the skin. So I like it for acne, cosmetic patients, topical retinoids, keratosis pilaris, and hidradenitis. Again, a great cleanser that's not too irritating that I recommend to almost all my patients.